Hi, you're very welcome to hear about social-haptic communication, hospital-haptices in healthcare settings. I'm Riitta, my sign name is Riitta Lahtinen, and I'm from Finland. I have been researching social-haptic communication last 30 years, and I started to do that research work first with deafblind people, acquired deafblind or congenitally deafblind people. That's my main research work area. I work at the Finnish Deafblind Association as head of the communication unit. So I teach deafblind people, the family members, PAs, interpreter, service interpreters, and so on, but different methods, how we can communicate and orient it in our environment. And my co-researcher here today is...
Hi, I'm Russ Palmer, and I'm a music therapist and also vibroacoustic therapy practitioner. But I'm also deaf and blind with Usher syndrome. I wear 2 cochlear implants and I cannot see anything at all. As you can imagine, Usher syndrome being a very gradual process, and in 2015 I lost my vision completely. So my research is focusing on the perception of cochlear implant users who feel music through their bodies, what we call vibrocentric approach. And I'm also part of the Andante research group, as with Rita, in the University of Tampa in Finland. I spend my time between various countries, UK and Finland, and in various projects as well, and I also very musical, etc.
So what's your sign name?
My sign name is simply like that, R for Russ.
Russ, okay. So today we like to share you why these hapteses in hospital or different healthcare settings are very useful. I remember when early 1990s was that when you need to go to cataract operation or some other hospital treatments, those days you didn't have cochlear implants, and it was very, very difficult to hear in very noisy situations, and it was very difficult to see the faces and lip read. And many nurses and hospital staff, they didn't know sign language or manual finger spelling. If they did write down some notes for you, you couldn't read them. So we were looking about that. Are there any common way of using touch? And that was part of my research work when I completed 2008, and it's called Social-Haptic Communication, Hapteses and Haptemes. Hapteses are those agreed touch messages we share, and haptemes are the grammar of touch. And we are going to explain a couple of situations where we have been collecting the data and then analyzing it. So I have a group of deafblind people who were going through, for example, cataract operation. You know that when you need to take your hearing equipment off and then they operate your eyes. So in that situation, you are totally deaf and totally blind. Perhaps you know the procedure about that 15-20 minutes operation, but what is happening and when, because you can't probably control the time, it's very difficult to know if 5 minutes has gone or 10 minutes has gone or what. And yeah.
I think from the user perspective, I can remember when I had my cataract myself, we had this sort of surgical blanket across your face. So you have one eye open and one eye shut.
Yeah.
And that automatically shuts down your way of communication. So the only way I could really sort of know what's happening is to have various Hospital-Haptices to let me know when I need to stay still and if there may be a little bit of pain, for example.
Yeah, because doctors are very good. They explain you what is going to happen. And we were talking with them and we asked it that, because you were not allowed to move.
No.
That can I or interpreter or PA or a nurse giving your arm certain messages.
Yeah.
So you were picking up about 10 messages would you like to have during that operation. And you were actually was picking up those messages. It wasn't me who was saying, okay, I'm going to give you these messages, but you were thinking, okay, what messages I will or I want to have. So we were going through different operations, and then I analyzed that what kind of categories we can perhaps have them. And I'm just going to show you an example here. I printed out this paper, what was you usually have with your hospital backpack. So on this paper, we have 12 different pictures, and I'm going through these, what they are. And it shows a picture like here that now it's going to hurt. So that
what we're just doing here, it's a bit like a squeezing of the arm, as if you're going to have like a blood pressure type thing.
Like hurting first, and blood pressure is just then a different kind of hurting.
So we had to separate these particularly because we had to be sure I get the right meaning in the right context.
Yes. Okay. So those are your choices at 12 different hapteses. So we analyzed them, and looking about that, can we actually categorize them? And for example, there are 6 different categories on your printed version. First one is that when you are there on the bed and you feel that someone is coming and perhaps touching you, you feel that there's someone, but you don't know who it is. You don't know if it's a nurse or doctor. So we need to identify us first at who we are. And for example, you agreed to having this kind of cross here, like nurse, and then the pulse taking is more like doctor. So the next categorizing was measurements. So we can measure different kind of things when you are there as in an operation hall or operation theater or after the operation. And we were showing already you one is this blood pressure. So, or perhaps we are measuring your pulse, or how the measurement, how wide your arm is. So that was the second one. Then the third one is emotions. So it means emotion is a very large area, but that is like if it's going to, if I'm going to be a little bit unsure that, are you okay?
Yeah. What Rita does here is give me like a little tick.
Yeah.
Like, okay.
That's okay, done,
And
done.
if I give a feedback, yes or no.
Yeah. Or you can verbalize that if you can talk. Yeah. It's like now it's going to hurt. That is one thing. I'm just going to do that upper part because my white hand is having contrast on your dark shirt. Yeah. Like it's hurting. Yeah. So these are like, now very calm, everything, and relax, everything is okay. So that is a part of emotional feelings, what we perhaps would like to give to you, or if I need to check Russ at how you are feeling.
What I noticed when Rita was doing this for me, my blood pressure was very low, much lower than I expected. In fact, even the doctors noticed my blood pressure was very normal. So it did have a special effect in that way. Yeah.
Yeah, that's why we were trying these in this kind of pilot work, that we were measuring the blood pressure and your pulse and so on, that's how calm you are during this operation. So then the fourth categorization was movements. So movements means like if you had an operation and you need to perhaps turn around or with pressure, do not move. This is now the place where you cannot move. It's very important. Like when this cataract operation, they were giving you an injection to your eye. Doctor said beforehand that you will have like 1 minute, you need to be not moving at all, no coughing, no movements, you need to be still. And then I will say you, okay, that's finished. Yeah. So when the doctor was saying that loud, then I was just doing
pressure, maintaining pressure all the time.
And
okay.
Now it's okay, relax. Now you can breathe again. So now you know that the worst is over.
But that was very important because otherwise I wouldn't have known what was going on because I had to take my hearing aids or implants off. So it's a very good way, I think, to get the two-way process of getting the real-time information as it happens.
Yes. Then the second one, next one was confirmation. And that means yes and no feedback. Russ, you were already giving me here the yes, tapping movement, and then side to side no. So if you are in an operation, Russ, and you want to ask something like you can talk. So you can use your voice. So that way it's easier for you to make yes and no questions. Let's say that you are in operation now and I will give you a feedback. What do you like to ask? For example, about the operation.
Is it okay to take my implants off?
No.
Do I need to be still?
Yes.
Things like that.
So that what is in your mind, you can then ask and having the confirmation, yes or no. So you need to practice that a little bit, and then you can.
And you have to have an agreement between the two of you.
Yes.
That's between you and an interpreter or personal assistant or family or friend.
Yeah. That is very good, this confirmation, because many people do them in any way quite quickly, and they learn these very quickly. Yeah. And they are more or less at first stage of haptesis that people are aware that when I'm saying, oh, yes, or stop, don't do that. So that kind of movement we have already in our body knowledge, if you like. So it's not very difficult to understand what these hapteses are.
Yeah. Now, if we take another situation.
May I just have the last category?
Sorry,
yeah. So the last category is length of treatment. So that is very important for some people like you, Russ. You wanted to know the time. So if something was finished, so it's finished. Yeah. Or then if we agreed that tell me when we have like 5 minutes left, so I do here on the clock time. So that is the length what we have agreed, that how much time we have left, or if you can start to feel relaxed that now the worst has gone, that okay, now that's finished, but you just still need to be there on your place and they are cleaning and so on. So different categories, 6 of them, we found it only for your 12 different hapteses. And then you were saying that another example.
Well, when I was in Brazil, for example, we were in a totally different situation. The first situation, I was in my native country.
Yeah.
So the language was English. But when you're in a totally foreign different country, such as Brazil, which they speak Portuguese, they may not speak much English. So what do you do in a situation like that? Back in 2015, I had a situation where I was in hospital for 1.5 months.
Yeah. And
it turned out I had septicemia in my leg, and I was high on drugs, and they had to do an operation on my leg. And the nurses were taking blood pressure, giving me this and giving me that, and I didn't know where I was.
Yeah.
But I couldn't communicate with them because they were speaking Portuguese.
They didn't understand English either.
So at 2 o'clock in the morning, you have to wake up, put your implants on, just to hear what's happening. And it didn't make my life very easy at all.
Yeah. So because we were 1.5 months isolated, so we thought that, okay, let's try to this kind of field research. That how about if we teach the nurses these hapteses? And every time when they were coming to you, and I said, you are nurse, so nurse. You are taking blood pressure. Now you are cleaning there, or everything is okay. So I was, oh yes, if you need to change the needle, yes, or if you needed to put it here on the, so you will then know what is going to happen. If it's going to be a little bit hurtful, or can you actually be relaxed? And we tried this with 4 different nurses. And when they came next time, it was very interesting to see that they did remember these hapteses better than the English words. Yeah. And then afterwards, they were just saying that, we can actually use these with many, many other people, not just the visually hearing impaired or deafblind people, because they are very good. And we were saying that it doesn't take more time, but it means that they have more time to be there with you, because when they are coming, they can at the same time giving you the example. It's almost like an eye contact when I'm saying, hello, I'm Nurse Rita here. So you spend that time in any way. But how about if you can't hear so well, or you can't see who is coming? So these can be then done when they are usually using their own language. They were using perhaps Portuguese at the same time, but you didn't know what is going to happen.
And it made me feel much more relaxed during the process, because I didn't have to put my implants on, and I knew, okay, they're going to give me a blood pressure check, and I could just let them do what they're doing. I was still half asleep.
Yeah. And then we were thinking that how about if we tried these, Russ, when you had an operation here, that you need to teach these to the nurse who is coming to the operation theatre. So what happened there?
Well, in this situation, I couldn't have an interpreter, PA or family with me. So it was a very, we had to first of all brief the nurses beforehand. What are the hapteses that may be helpful for me to make my life much easier? And this is exactly what we did, and it worked extremely well. Some of these Rita will now explain.
I do remember that when the nurse was, you call the hospital and say that they come 5 minutes before, and if they are keen to learn 5 to 6 different hapteses, that it makes your blood pressure down and you are more calm during this not very comfortable research in the surgery operation room.
It was actually relating to treatment for compressed piles, for example. They needed to check certain things before they could do the operation.
Yeah.
And it was very, very difficult to wear the implants on, because you have to move a certain position, and you have to sort of stay still, and if you needed more oxygen and things like this.
Yeah.
So it's a very interactive process, but the nurses were wonderful.
Yeah. So you asked it that because they said that the nurse will be all the time with you. Exactly. You were saying that first one is give me indication that you are there. That was the first one. Yeah. Then you were teaching yes feedback and then no feedback. Yeah. Because you said that I am going to make the questions. Could you please then just answer me using yes or no? Yeah. Then you wanted to know that if it's going to hurt. Yeah. And then you wanted to know that when you need to stay still, because there was very many places that you couldn't move. Yeah. And then like how to move you. Yeah. So which side you need to be, or is this okay, or what? That's right. So there were 6 hapteses, and the nurse did learn them straight away. So when you were doing them to the nurse, then the nurse was repeating them to you beforehand. Right. And that just took 5 minutes. Yeah. And afterwards, when they came back, I do remember when the nurse was saying that they are very, very useful with other elderly people, people who has communication problems, dementia people, and almost everybody who just need that kind of confirmation. And then she said, actually, when I'm thinking about, we use these already, but we have not been thinking or analyzing that we are actually using them. But now, when I know this, I can then take them part of my routine when I use spoken language and so on. So I can actually then use touch also at the same time.
And even the doctor was very pleasantly surprised how well it operated. The whole thing functioning very, very smooth. And I remember one nurse was just gently sort of relaxing me because she perhaps sensed I was a little bit tight or anxious. And this worked extremely well, just like a little stroking, just to say everything's fine, just relax, without having to say anything.
Yeah. In the beginning, I was talking about that all hapteses have their own grammar. And I will now describe what I mean by grammar. So these haptemes means that every time we do something here, like it's the location, and like the blood pressure is always on that area where they are taking the blood pressure. Time is always there where you are using the watch. If I'm just doing that on the shoulder, that means more.
It doesn't mean anything.
That, oh, there's someone who wants to have a contact to me.
So you have to think of a context of where and what you're doing. And that's the most important part of all of these social-haptics.
Then you already was explaining about the pressure. So when I'm saying I am here, it's light. And then when I'm pressing very hard, it changes, do not move.
That's right.
Stop what you're doing.
And that's a safety guideline too, because the person who has a deafblind condition is not aware of what's happening around them. So they may be feeling anxious inside because they're unsure what's happening. And it just helps to get the flow of information going from one person to another. And at the same time, it's making the person feel relaxed at all times.
Yeah. One grammar element, one hapteme is duration. And duration is, for example, there when I say now stop, don't move. And if the doctor is saying that just do not move, and I will tell you when you can. So I hold my hand there, that's 1 minute. And then when doctor said, now it's finished, now you can relax. So that is the duration. So some hapteses like blood pressure can be just 3-4 times. I need to give enough time anyway, that when I'm doing it, so it takes about 3 seconds, 4-5 seconds, you to understand in that context, okay, what I'm trying to explain to you.
And you also, that's really like a delayed response. So you have to take that into account.
Yeah, I can't do it quickly. So
it has to be, do the haptes or the haptemes, and then wait for the response. So the deafblind person knows what's going on. Because you have to remember, if they are drugged at all, they may not be totally 100% being able to understand what's going on. So you have to allow response time.
Yes. I have been talking and sharing this with other deafblind people or visually hearing impaired people. And there are some common elements about the basic information, the basic hapteses, what we have now shown. And then you will have some additional information depending your individual needs. So we have done like a hapteses dictionary about going to a hospital, and then you can choose the pictures. So you can collect that, what I was showing, like your little paper. So it's just reminding that, okay, I use these in this kind of situation. And you need to explain, or not perhaps explain, but you need to experience them beforehand. So you need to practice them, that, and how do I do it? So if I have a person who is going to hospital and say that I like to take some Hospital-Haptices with me, so what are they? So what I'm usually doing is that I'm having you to the situation that now you are on your bed, okay, and teaching that this is the blood pressure, or I'm asking that what you think the person is going to do for you, because many of these you have already memory that this means blood pressure. Then you do that also for me, so you know how to produce it. Because if you are going alone to the hospital, just like you did go and you were teaching to the nurse, that you need to know how to produce it. So you learn to receive it and also producing it.
The other thing I should have mentioned earlier is that when we were in Brazil, because we had different nurses and different professionals coming to visit me, not everybody understood about the deaf blindness.
Yeah.
So when we came back from Brazil, we thought, we really ought to have some sort of identity aspect that says deaf blind, so the doctors and everybody else understands this person cannot hear or cannot see so well, because they don't always put it on your tags. And it's taken for granted. They think you can see. Yeah. And many times I had to explain, sorry, I can't hear or see you.
Yeah. So when we had also tried this in one other pilot, that okay, if you have this orange deafblind wristband there, So do they remember better when they are coming? They explain who they are and what they're going to do. And some way you said that, yes, this is a very good because it's orange. You don't use anything else there. So they recognize, and once they have seen that, the next time when they only see that orange color, they will recognize, oh yes, Russ is deafblind, so we need to do another way of communicating.
And some other deafblinds have actually taken this on board and they've actually used it in their own situation, even just going to the, if it's going to some official department, for example.
Yeah.
And finally, I think we should just mention that the Hospital-Haptices is part of a subgroup of the overall social haptic communication. So if anybody wants more information on what Vita's doing and various papers we've published, please visit our website, www.russpalmer.com.
Yeah, and you were saying about the subgroups, it can be like emotion, face expressions, how we are hapteering the room, how we describe the room, different food, how people are walking, what is happening in your environment, directions. We have a subgroup of like if you are riding a horse, if you're doing a yoga, if you're watching football. So you have different kind of categories of this. And Hospital-Haptices is one category. Yes, and please visit the website, and there's also our email address if you like to be in contact and know more. But in our website, we have these Hospital-Haptices article links and other if you are interested to learn more.
Okay, thank you for listening and take care.